you. Thank you very much. Uh, at the outset, I would like to thank organizers for inviting me to Bangladesh. And since last, I think, 5 6 days, uh, I'm here in Bangladesh. Thankful to Dr. Azizul Islam, Director of Research and Extension of Sivasu for chairing this session. Um, Chief guest Dr. Lutfur Rahman, Dean of this college. Mr. Iqbal Hussain, I know him since around a year now because he came in contact with me in connection with some problems in his farm. Uh, and I'm also thankful to Dr. Mizanur Rahman for giving me invitation. Um, my friend from India, Dr. Shiva is also here. So what we decided uh, that in this training program, I would be talking more about how to prevent the diseases, how to improve health and productivity, so that 95% of the animals all the time are healthy and productive. And then whatever diseases we will still have in the farm. Then there are techniques and methods that will be shown by Dr. Shiva to take care of those diseases. Friends, I have been going through many countries, in SARC, and I find that mostly problems are same. Only the intensity should be less or more. Uh, Now, one of the thing we should keep as a reservoir we should keep in mind is that the livestock population always will remain plus minus 5% in any country, and that is the trend globally because I have analyzed the data for global fluctuating population from 1970s to 2019, and I find that in most of the countries the population will vary between plus minus 5%. So one shouldn't be really bothered about if animal population is going down because this is one question all the time politicians will talk about and then tell you that we have got so many colleges, so many professors, why the numbers are going down. The numbers should go down, but the productivity should go up. Globally, the trend is less number of animals so that you get more productivity and therefore the cost of production is going to be less. Now, second problem we must understand is that this dairy, especially dairy, is always related with agriculture in the sense land. Because if you want to produce milk cost effectively, what you need is fodder because that is their natural feed, and then that will bring down the cost of the milk production. So therefore, whenever we talk about dairy farmers and we mean dairy farmers, we always tell them that how much land you have, that should be the starting point of how many animals you are going to keep, how much fodder you can grow, and through fodder how many animals will be able to keep productive. These are some of the key factors we always insist upon the farmers. Now, since there are friends, student friends here, I think there are some final year students as well as students who are doing masters. A piece of advice to them that daily practice offers you lots of you know opportunities. Unlike in India, we find that most of the vets are interested in small animal practice because it looks more glamorous. It is more kind of station and you get more money from it. But if you really have good practice even in large animal, then I think you also have equal opportunity. And therefore, I always, encourage the students to go for a kind of cluster private practice. You can catch an area where there is good daily infrastructure already present in the sense that you have farmers who are interested in dairy. Then you have got milk processors who are ready to collect milk. There, if you start your practice as a team, never start a veterinary practice alone because if you want to cover a larger area, then you have to also cover artificial insemination, breeding, nutrition. So all these as a basket of services, if you can provide to the farmers, then there will be lot of takers, and then you can also have your own facilities created slowly. We have got now many vets who are into private practice, and they have, at least in Maharashtra, I know there are many vets who started private practice, large animal private practice, coupled with small animal practice whenever it comes to, but predominantly 90% it is large animal private practice they have. They have all the facilities like clinical pathology lab they have. They have got vehicles to move around, and then they provide very good services to the farmers, and they are doing extremely well. I know in Bangladesh there are difficulties in large animal practice, and one of the issues which I could always find out is the nutrition, and I think that we will be talking about when I be talking about herd medicine, and then also other issues we will be taking up. But more, a piece of suggestion and advice to the young students that you try to get into business also. I find that in Bangladesh, we are not into manufacturing of a lot of things that are required for veterinary profession, and much of it comes from outside, and then there are people who here who are distributing. So even manufacturing should not be an issue. You should get into it, and like for example, feed, feed supplements, even medicines. Those are not very difficult to manufacture. All you need is investment, and there are opportunities of getting investment. So getting into business by the veterinary graduate is also equally important. So with these few words, I take the leave. We will be having a session later on, and then tomorrow we will be going to the farm, and there I'll be able to tell you more about how a farm visit should be done. What are the points you should, from the point of view of assessing the farm health status? What are the essential things you will have to observe, you will have to follow, and what other processes and methods you need to do. So once again, I take your leave, and I'm express again my sincere thanks to the organizers for giving me this opportunity. Thank you.
Thank you, Professor Abdul. Now I would like to request our Honorable Chief Guest of the state program, Professor Dr. Mohammad Lutfur, Dean Faculty of Veterinary Medicine, Sivasur, for giving his speech as Chief Guest.
Bismillahirrahmanirrahim. Honorable Chairman, Professor Dr. Azizul Islam, respected special guest, Nurul Islam from INSEPTA, Iqbal Hussain from AK Group, special guest, Professor Dr. Abdul Samad from India, and coordinator of this training program, Professor Dr. Mizan Rahman, Department of Medicine and Surgery. And in front of me, advanced field veterinarians, advanced student of Sivashu, and renowned field veterinarian, and trainer and trainee, my best wishes and good morning to you all. Today, I am very delighted to be here as as a chief guest and to get the opportunity to deliver few words in front of you. It is true that where there is life, there is disease. So we cannot consider our life without diseases. We have to stay together, life and disease. I can memorize, maybe it is 2014 or 15. Last time I visited Texas A&M University, USA. During first meeting with my mentor at that time, I asked my mentor during discussion, so what are the diseases in your country, are most common or available diseases in your country? Do you have anthrax? My mentor told me, no, we don't have anthrax. It is eradicated. Then I asked, do you have black quarter? No, it is eradicated. Do you have rinderpest? No, it is eradicated. So what do you have? What about viral diseases? Do you have ranicate? Do you have ganguro? Leukosis? No. Most of them eradicated. And if there are some diseases, we do vaccination. And I asked him, so why I came here, I don't know. What I will learn from you. Then he told me, we do one thing. We have, it is true that we have fungal diseases in our country. We have mycoplasmal diseases in our country. We have some other skin diseases in our country. But what we do, without any confirmatory diagnosis, we don't give any treatment. It is our main strength. So every year, then I told him that every year, lots of money you receive from the government. So what do you do with that? He told me that we used this money for vaccination, for research purpose, and for increasing our laboratory resources. So now, if I focus in our country, we can see that every farmer, their general demand is to make a profitable farm. So it's very normal, it's very general demand for everyone. But the problem is, they are struggling every day to make the farm profitable. And nowadays, the farmers are very educated. They know many things. They have technical knowledge. Now, for more profit, they shifting their farm from local breed to high yielding crossbreed. But the problem is, when the high yielding crossbreed they shift in our country due to our environment and some other problems, they are very prone to several types of diseases. But we don't have enough knowledge to handle these diseases. So I think holistic approach is very essential, very crucial for our field veterinarian to know not to know about the nutritional aspect, to know about the reproductive aspect, to know about the adult health aspect. So we don't have sufficient practical or skill knowledge or field knowledge regarding these issues. That's why we are struggling every day. I believe that if we can properly diagnose, that means PCR-based diagnosis or confirmatory diagnosis to know the causal agent of these diseases, then it will be much more benefited for the veterinarian as well as for the farmers of this country. That's why I think today's training program is very important and very logical and time demanding training program, and the field veterinarian and advanced student will able to learn many techniques from this training program, that means today's training program. And I have seen that here the trainers are very efficient, very experienced, especially the two professors from India and Professor Imran, Dr. Farhad Hussain. Long time they are practicing in our country, and I think they will able to teach them practical oriented knowledge in different farms surrounding Chattogram.
Thank you, Dr. Mohammed Lutfur Rahman. Moving forward, I would like to request the chair of the training program for concluding the session. Professor Dr. S.K.M. Alizul Islam, Director, Research and Extension, Sivas Group.
Chief guest and special guests and distinguished participants and distinguished professors and persons from different organizations, dairy farmers, uh, and pharmaceutical industries. Very good morning to all of you. This is an auspicious occasion for this university as well. We are uh, we are practicing veterinary services in our country. We shifted from traditional to modern service veterinary practices. Now, this is changing. So, in this regards, we need to update our knowledge, and the participants and guests are just there. Our production is increases, but our land is limited. So, so with these limited resources, we have to increase our production. Already, meat production is increased and meat production also increased. But we are facing problems. During the field practices, our veterinarian faces problems in diagnosis. So this training program is completely on clinical diagnosis of diseases. So it is very much important for us to uplift our professions as well and the production as well. And I congratulate our organizers to arrange this such auspicious program for our practicing veterinarians and those who are participating in this program. I thanks to them and all the contributors and distinguished person from India and our respected trainers. I am very much happy and very much happy to all of you on behalf of our university. I again congratulate you for this participation. And this study program will be asset for our university and as well as our country, and which will give a base to upgrade our veterinary practices. Lastly, I would like to share our one knowledge
Professor Abdul sir pointed out that our practice should be the community-based services. Community-based services will help us to upbuild our sector. So this is a time demanding time demand. So I am thankful to our brother again. Thank you so much. With these viewers, I conclude this session. Yeah.
Thank you, Dr. S.K. Abdul Islam. With that, we are ending our inaugural session. Now, we will begin our training session. At first, I would like to invite Professor Dr. Abdul Samad to conduct the session on heart health management in daily practice.
আমার মনে হয় আপনাদেরকে বিশেষ করে যারা বাইরে থেকে আসছেন এখানে যারা রেজিস্ট্রেশন করছেন আমাদের একটা মিসকমিউনিকেশন ছিল আসলে মিসকমিউনিকেশনের জন্য আপনারা ওই প্যাডটা পাননি আর কি কালকে রাতে প্যাডটা পেয়ে যাবেন আর কি আর হলো আপনারা শেষে আজকে মানে আজকে ট্রেনিং শেষে আজকে আলোচনা শেষে বিকালে আমাদের সাথে দেখা করুন যারা কাল সকালে আমরা এসে যাবো আমি যাবো আপনাদের সাথে কিছু কালকে সেশনটা সুন্দরভাবে করতে পারেন ব্যাংকের জন্য কিছু আলোচনা আছে একটু আমার সাথে দেখা করবেন যারা বাইরে থেকে আসছেন রেজিস্ট্রেশন তারা করছেন থ্যাংক ইউ
Right. My introduction to herd medicine, which is also called as population medicine, was accidental. What happened? There was a Commonwealth scholarship advertisement in India, and looking at the number of scholarships for different subjects, I found out that chemistry and biochemistry, which was chemistry and applied chemistry, was having 12 scholarships, whereas veterinary science was having only 2 scholarships. I decided to apply in chemistry, and fortunately I was selected. And when I went to Canada, there I was placed in a program which they call it Sandy program, and I was told that you will sit in chemistry department, your research will be in chemistry department, but your registration will be in veterinary college, and you can choose whatever subjects you want, whatever courses you want, you can select. So I had gone during winter season, and you know that in those countries during winter season less number of courses are offered. So good courses are offered during spring season. So I chanced upon this particular herd medicine course which was offered by Department of Population Medicine, and you must be reading a book by Dr. Wayne Martin. So he was the course teacher. And taking this course opened up my eyes that probably what we have been practicing in India was too shortened, version of practice. We were more focused on, diseases. We were more focused on treatment of diseases. And when it came to preventive medicine, we always thought that vaccination is probably the start and the end of the preventive medicine. And there we were given lots of case studies, and then the first thing which struck my mind was that diseases are not caused by bacteria alone. Diseases are not caused by viruses alone or fungi alone. This was probably an old understanding, old thought during Pasteur, Louis Pasteur days. And therefore, you'll find that many diseases are named after the bacteria. For example, tuberculosis is named after Mycobacterium tuberculosis. Pasteurellosis is named after Pasteurella multocida or Pasteurella hemolytica. And therefore, we always thought that tuberculosis is caused by Mycobacterium tuberculosis. Pasteurellosis is caused, hemolytica is caused by only Pasteurellosis. But then later on it was found that it is not bacteria and virus alone which will result in disease. For example, if I take example of tuberculosis in Mumbai, if they say that 10% of the population is having tuberculosis organisms, carrying tuberculosis organisms, then in that case, when I am traveling in local train, which is having at least 200 people, then there will be at least 20% who will be having tuberculosis and might be expiring tuberculosis organisms. But many of them do not suffer, and therefore carrying of any bacteria or carrying of virus is not necessarily a proof that a person is having disease. So they came out with a model which is called as multifactorial model. And for practicing herb medicine, this is a very important factor which you keep in mind, that diseases are multifactorial. They are not caused by bacteria or virus alone, but there are also other factors which are necessary, for precipitating of the disease. And those other factors are called risk factors or contributing factors. Whereas bacteria, virus, fungi, those will be called as necessary factors or essential factors. So unless there is Pasteurella multocida or Pasteurella hemolytica, disease will not be caused. But alone it will not cause the disease. There will be factors, other factors, which will contribute, and then the disease will be caused. And about that, and then controlling other factors is very important compared to bacteria and viruses. And I'll give you one case study which we did when we were, doing that course. Nearby, there is a Bruce County, there is a county called Bruce County, in Guelph. And this particular, case is also called as Bruce County case. Now in Bruce County, what they used to do, there was a big sales yard, and then lot of calves and other animals used to come to that sales yard for selling, and farmers will come, and then it will be the animals will be auctioned, and then animals will be taken from there to the different farms. And they found that shipping fever was very common. And we all know that shipping fever is caused by Pasteurella hemolytica, along with certain viruses like bovine syncytial virus. So the theory was that bovine syncytial virus will be the first to attack, followed by Pasteurella hemolytica, and then shipping fever, and then mortality. Therefore, they were all trying to find out what exactly is happening and how to control this shipping fever. So a small project was taken that the data will be collected, because when they have sales yard, there are different compartments. And then looking at the data from the compartment, they found out that there are only few areas where shipping fever was very common, and there were few where shipping fever was not seen. And they tried to find out what is that factor which is present in those compartments where there was shipping fever, and what is that factor which is not there, in those compartments where shipping fever cases are not usually recorded. Now remember, when I say not recorded, it means that the frequency of disease is more in one area. I'm not saying zero. I'm saying frequency of disease is more in one area. Diseases of frequencies is not, so much in the other area. And the data found out that when you are mixing different age groups of animals, when young calves and the aged cattle were brought together and housed together, the shipping fever was more common. And therefore, another experiment was done where where in the same sales yard, the animal of different age groups were separated, and they found that the shipping fever was under control. So a very simple message that age is also an important determinant of shipping fever, and if you don't mix different age groups of animals, then probably the chances of transmission is less. And this takes me back to a very original investigation done in London. That's also a very very common cited epidemiology case history. Now in London, cholera was very common, and there was one plumber. He was very curious, and he wanted to find out what is why there is cholera. And when he looked at the map, where cholera cases were being reported in London city, he found out that there were some areas where cholera was, very common. The number of morbidity and mortality was high, and in our area, morbidity was also not much, and mortality, of course, was not there. So being a plumber, he thought that probably it might be related with water. So what he did, he went to the source from where water was being pumped to different areas. So he found out that there were two sources of water which was being what was supplied to those sources to London city. So he did a very simple experiment, and that's why sometimes he's also called as father of epidemiology. So what he did, he just switched the supply motor. So the one which was supplying to the city where cholera was not seen, he started supplying from the reservoir where the cholera cases were being seen. So he shifted the supply, and then he noted whether there is any shift in cholera cases. And then he found out that the moment he shifted, the problem started. So he found out that the cause of cholera, if you ask to any physician, he will say that it is caused by a bacteria. Whereas the plumber find out that the cause of cholera is contaminated water which is being supplied, and that is the reason why cholera cases were seen. So these are very classical examples, which gives you a deep understanding that understanding the entire disease process holistically, right from the causal factors to how it is transmitted, is important. That is what is called as herd medicine. In herd medicine, what we do is we don't look at individual animal. That's why it is also called as population medicine. We look at the population of total herd as a unit. We take total village as a unit, total city or a state or a country as a unit, and then try to understand what is happening. And for that reason, what you need is data. If you want to practice population medicine or herd medicine, and if you are interested in increasing the productivity as well as improving of the health, then the basic factor is you must have records, you must have data. And if you do not have data, you do not understand. Because what happens in case of clinical practice, many times, because of lack of access to the diagnostic facilities, what we do is, with our experience, past experience, we immediately, diagnose the case, and that is called as Auntie Elizabeth, way of diagnosing. Now, if suppose Auntie Elizabeth is there in a group of people, you can still look at it and identify that hey, this is Auntie Elizabeth. Why? Because the impression of the face impression of that lady is there in your mind. So same thing happens in case of clinical practice many times. when you look at a case, that case memory is there in your mind, and you try to apply. For example, if it is a foot and mouth disease, you have in your mind that in foot and mouth disease there are blisters in the oral cavity. The animal will be lame and temperature will be high. So immediately you diagnose, and it is not necessary for you to go through the diagnostic process. And in other cases, what you do is you try to treat and then do reverse diagnosis to find out if I have given treatment, if it has resulted in any improvement, then we say, okay, this probably, bacterial infection was the cause of the disease. Now, in case of heart medicine, what you need is, you need to prevent the disease. So, therefore, you have to predict, when there is going to be a problem. So, therefore, recording is extremely important. Now, in case of heart medicine, we pay more attention to health rather than disease. So that's why it is also called as health management and productivity management. And health management is always very difficult to implement rather than disease management, because if you have disease management, you have got certain tools like medicine, drugs, hormones, etc. to inject and improve and get rid of the disease. But in case of health, you have to look at holistically, and there are many factors which are responsible for for the status of the health and productivity. And that is the reason when I returned from my PhD studies, I thought that unless and until we have a data recording system which is suitable for small board, we will not be able to implement this concept. So the first thing I did was I started looking at now how I can develop a data recording system. And this is somewhere around 2000, year 2000, 2002. I was talking to many IT people, and they did not show much interest. In Mumbai, if you talk to any IT people saying that I want this software to be developed, this system to be developed, they will say, okay, what is going to be the scope? How much of sale? Because he has to invest in developing the software, and I couldn't tell him whether there would be any what is going to be the scope, etc. was not with me, so many were not interested. So what I did, I wrote a small proposal to Indian Council of Agricultural Research. That is a funding agency for certain research schemes. So I sent a proposal to them saying that this is what I want. And then, my idea is to have a data recording system so that through it, I will be able to analyze and implement a preventive setup, in certain, identified areas. And then they called me for presentation. I gave the presentation. And then most of the people, experts sitting there, they thought that, this is something like a crazy idea. That I am talking of in animal husbandry sector, number one, computer, and then data, then analysis and recording. So they all said, who is going to do this? Because farmers don't have computers. It's very difficult. During 2000, these smartphones were not there. So, collection of data, etc. Would be very difficult. So anyway, they thought that this is not a good idea to support, so they did not support. Once what happened, I was going to Delhi for some other official work, and there was one gentleman who was sitting, beside me. So we started talking, and then he told me that he is into IT sector. I told him that India is so ahead in IT sector, but agriculture and animal husbandry is being neglected. Especially animal husbandry, nobody is interested in helping the West to develop a kind of system for data recording. So he said, well, this is a software, people are very expensive and we have to invest a lot. So unless there is a ROI, return, we will not be able to help you out. And the matter ended, we exchanged telephone numbers. And then after he called me saying that, I thought about, what you have said. And I'm deputing, two IT persons to your department. They'll sit with you for 1 year. And you can take whatever work you want, and then I'll pay their salary. That is how this, data recording system, started in India. So we developed with them, a very primitive kind of system, which was based on desktop version. And now we have a system. I'm describing you this because when you go along, there is always a lot of improvement. And unless and until you have such a recording system for suitable for Bangladesh, you will not be able to implement this herd management system. So the system which currently we have is, number one, all animals have to be identified. So if you are working say for a village, or for a block, then in that case, unless and until your animals are identified, you will not be able to keep the records because you need identification of animals. So for that there are different gadgets available, and the simplest one is ear tagging. So what innovation we did in ear tagging was that instead of having only the numerical number, we decided that we should have a QR code on it. I'm talking of this particular development year 2012. And 2012, QR code had just started. It used to appear in newspaper as well as in some magazine where they would say scan it to download more details. So mostly the QR code was being used for downloading the information, and by that time QR code was not being used for uploading the any information to the server. So it was only one-way traffic. So we did some study, and then we found out that it could be possible for us even to scan and send the information or data to the server. So we developed that ear tag because we thought that it will give lot of advantages. Now the advantage of that ear tag is that when you scan it, with our app, so our data recording system has got different components. So one is ear tag, second is your cell phone based app, and this cell phone based app which we have is also a scanner. So you can record the data of the animal as well as it also scans the QR code. So the moment you go near the animal, you can scan the QR code, and by that you get connected to the animal. You get connected to the animal's file. The file will get open, and then you can enter the record. So it has become extremely simple for us to record. Number two, when you are scanning, there is also an imprint of time of scanning as well as place where you are scanning. So it's also geo attack. So you make sure that the data is coming from animal side, because if you want to store and if you want to have animal data, it is very very critical that your data has to be credible data, and you have got always problem that people may not go to an area and send the record properly, but they will sit at home and create fictitious data. That had happened in one of the milk recording programs which Maharashtra had started. So we had appointed number of milk recorders who would go to the farm and send the milk records. And ultimately we found out that around 75 to 80% of them were hardly visiting one or two farmers, and rest of the time they were all sending fictitious data sitting at home. So how to get data which will be credible and coming from the animal side? So this QR code, when you are scanning, then only you open the file of the animal and you can enter the data. So you are sure that the person has gone to the animal side, and from there he is sending the data. The second important factor for for data recording is that it should be analyzed immediately. There is no point in analysis later on. You can have certain analysis at later point of time, but for herd medicine, it is extremely important that as soon as the data comes, you also analyze the data, because you would like to understand what is happening, what is the impact of whatever you are doing. So, for example, if you are doing suppose entry of the insemination, then in that case the insemination results immediately should be communicated to the farmer, saying that your animal has been inseminated. Or if the animal has been inseminated second and third time, then the farmer has to be informed that there is this is the third insemination, and this time we have changed the side. So all those information flow should be there, both to the inseminator as well as to the farmer. The second thing your system should do in order to implement the herd medicine program or herd health and productivity management program is that the data should be analyzed, and that analyzed data access the person should have when he is visiting the animal. For example, right now, what is happening? If I go to a farm and if I am presented, let's say even a diseased animal, I don't have any previous information about that animal. I do not know when it has been vaccinated, whether that animal had dystopia earlier, whether there was metritis, what had happened in the last correction. So I don't have the life history of the animal before me. Then in that case, I have to only look at the animal and the current event is to be analyzed, and then I'll be giving some kind of treatment, and if that doesn't work, then the second treatment. So once you have data system with you, when the vet will go and scan, he will get entire case history of that animal right from the birth. What has been the growth rate, what vaccinations have been carried out, what other illnesses the animals have suffered. So the vet has access to all the information. So what you have done now with this data recording system is your service now has become more information based. Earlier it was all ad hoc based, looking at the animal, and now you are taking a decision based on information. And as you know, that most of the management people will tell you that anything which is not measurable cannot be improved. So therefore, you have got now a measure of the health, a measure of the production to improve upon. So your services become information based. Let's say, for example, if an AI worker goes and if he scans, if you want to do incineration, he'll get detail of what were the sites used earlier, whether the animals, breeding history was normal or whether something has happened. So all those details is there. And at the same time, he will also get other information. For example, in that area, which are the sites which are having higher conception rate? Who is the best inseminator for the farmer to know who is having a greater conception rate? So all that analytical information can be shared with all the stakeholders, and therefore the services become quite improvised, and it is more information based, so that information based decision the AI technician as well as the veterinarian will be able to take. I'll give an example of one company in south of India who started using our system. Right now they have got around 1.2 million animals on the platform, and the entire the production management, everything is revolving around that data recording system. So what we did, after 6 months we analyzed the data, and after analysis we found out that the overall conception rate in that area, I think that at that point of time there were around 500,000 animals were there on the platform. So we analyzed around 100,000 insemination data and found out that the conception rate was very low. It was around 22 to 24% under field conditions. That was in the state of Tamil Nadu. And when we analyzed the data for sire, we found out that there were 3 sires. They were having conception rate less than 10%. And there were sires who were having conception rate which was 45 to 50%. So all we did was told the management that these are the 3 sites which are not performing well in the area. Therefore, you don't take semen from them and stop purchasing semen for those animals. And then we showed them that there are other sites who are doing extremely well, you can go for that. And they implemented that program, and after 3 months, we found out that the conception rate had increased from the 22% to around 35%. So one simple intervention by data analysis, that the problem is with the sire and not with your animals and inseminators. That strength you get only from the data which you have, and if the data is credible and analysis is properly done, then you will be able to tell exactly what exactly is happening. So therefore, this herd medicine approach is more now information based. So unless and until you are extremely well into information technology, the implementation of herd medicine program is not going to be possible. So I pay a lot of attention to data recording. There are difficulties in data recording, and I have found that mostly it is the factor of accountability and transparency which makes people reluctant to start using it. Especially if you go to farms, you'll find that the farm managers are not interested in using this kind of data system, because then if the data becomes available, you can do impact analysis, you can do what is happening, and then they feel that probably the blame will come to them. When we started, in Maharashtra, we told the government of Maharashtra that we should have such a setup and start data recording system, and through that we will start some preventive medicine programs in this state. The first thing was that all the vets, they said we are not going to use this, because they thought that if they'll start using this, probably the entire things will become open and they will be unnecessarily blamed. So therefore, as a vet, whenever you want to start this kind of program, you have to make sure that all your employees or other subordinates who are, or the stakeholders who are going to be in this program, should be told that after data analysis, they are not going to be held accountable. It is going to increase their efficiency, it is going to increase their work. Now, in that particular Hudson area, we find that earlier the vets used to say that they are sidetracked, they are not being given importance in the organization, because they are all doing work which is related with treatment. And whenever management asks them to show them what exactly work they have done, they do not have much information to reveal to the management, except that they have treated so many animals and so many insemination has been done, and there is no traceability of calf born, there is no traceability of how those calves are doing. But now what is happening, once they have implemented the program, now they can even do forecasting. And with forecasting, they are able to now tell the management as to in which milk collection area, how much of milk is going to come. So once you have this kind of system, then you can even go for forecasting. So forecasting of inventory build-up, forecasting of what is going to be the productivity, forecasting of how calving is going to take place. So they also know, they schedule that during the month of say June, so many calvings will take place. During the month of September, so many calving will take place, and based on different breeds of animals and their productivity, averages, they can calculate, how much milk is going to be produced, and out of that, how much milk is going to come to each collection center, and therefore the management is now ready to plan for the processing of the milk. So one simple intervention when you start, with information system, then lot of benefits start accruing from it. Another case, study which I would like to present before you, which will tell you importance of understanding common source and symmetry and asymmetry. Now, this is a very basic principle I always follow whenever I am presented with a problem in the farm. Mr. Vishwas Chitle was here, for the workshop, and he owns a very big farm. So he has around 500 cows and buffaloes, and he also had around 50 bulls, and those 50 bulls were used for semen collection. So what happened? He had problem of libido and sperm count as well as sperm motility, and he was he called number of vets in the area, and they all came and they started treatment with different like tentex codes, women codes, somebody said testosterone should be given, all kinds of treatments were given. And then somehow he found out about me and requested me to come down and help him. So I went to him, and I asked some very leading questions, and that is what I usually do whenever I go to a farm. So number one is the problem common in most of the animals in the farm? This is the first question I asked. So he said yes, we have got 50 and around 40 animals are having this kind of problem. where libido is not normal and then sperm motility is also affected, and especially after thawing, after thawing, the mortality of in sperm is very high. So one thing is if it is in predominantly most of the animal, that means the problem is common source, right? So if it is common source, it has to be the environment. So because all the animals are in the same environment, number one. Number two, water. Number three, feed. These are the common sources in the farm. So I said, okay, number one, it is a common source. So let's see, what is happening. So I said, okay, let me examine 4 or 5 animals. So I took out 4 or 5 animals, examined them, and I found that they were having bradycardia. I checked that their extremities, I found extremities were very cold, and it was not winter season. And I also found out that they were not also given bath, so water, etc. So but still very prominently the extremities were cold. And suddenly it said to me that this is probably because of iodine. So I said this is this may be because of iodine deficiency. So I inquired with them, what kind of water they are supplying. And since those were the bulls which were brought from Sweden, they thought that these animals need highly purified water. So they had all kinds of RO and distillation plant through which the water was being purified and supplied to them. And then I looked at their mineral mixture, and then I found out that in the mineral mixture, potassium iodide was being used. And we know that potassium iodide is sublimated over time period. And therefore, after 1 or 2 months, you'll find that there is no iodine present. Potassium iodide has sublimated and evaporated. So I told them, your problem probably is iodine deficiency. I prescribe one powder to you. Give 1 gram daily, and then after 10 days, let me know. So I just gave a prescription, and then they found out from the market that it cost that sodium iodide. The cost was somewhere around 250 rupees. And they thought that 250 rupees what prescription is given, whereas they had spent lakhs of rupees on number of vets who had come and given treatment. So what to do? But then they said, okay, let us try, and they gave potassium and sodium iodide, and after 10 days, slowly the animals started coming back. So this is the importance of application of the principle of common source. Secondly, I also apply even in clinical medicine. There is also a branch, Dr. Shiva, and I took that course in McMaster University. In there is a parallel nearby university. So there was one with Dr. Sackett. He was an ace teacher. When it came to clinical epidemiology. So medical. So what he used to do, he used to apply the science of symptoms and other factors in clinical decision making. And so I had taken a course with him, and I know that epidemiology can also be applied to clinical medicine. And I'll give you one example, which he has narrated, in our course, and that was he did an experiment wherein he started looking at physicians. At what point of time a physician will make diagnosis of a patient during the examination, and then he was noting down the behavior, and then other factors, other questionnaires they were maintaining, and he found out that most of the physicians first diagnosis is already done when a patient enters and spell out the first symptom. Okay, by that time the diagnosis is done. All other things which are doing later on is going only to re-strengthen what he has already decided. Number two, experiment they did and found out that the correctness of diagnosis with physician ends with 10 cases. So earlier 10 cases is precision of diagnosis is correct. As the time goes on, the diagnosis also become imperfect, and the likelihood of making more errors. So having all this data and analyzing the data. So one simple thing they started in McMaster University was after each 10 questions the doctor will go out, spend some 5-10 minutes, again come back and then start the examination. So one simple intervention would solve lots of problems. So what I was talking about was that iodine was given and then immediately the problem was sorted out. I have got a group wherein a lot of people send their case studies if they are into any trouble. And I always find out, I always try to find out one more thing, whether the lesion which you are seeing is symmetrical or asymmetrical. Is it only on one side or it is on both the sides? One simple information will solve you the problem, that if it is only on one side and the other side is not affected, mostly it is local. And if it is both the sides and symmetrical, then mostly it is systemic origin. It is central in origin. So such simple questions will also, in case of herd medicine, will give you lot of information about about the decision making. One more case study I would like to describe right now is, many times we are called upon attending the outbreak or the mortality. So there was this case where near Mumbai, few teachers, they took VRS and collected their money and started a goat farm. And this goat farm was very well managed, goat farm. They invested a lot of money. Everything was fine up to 6 months, and then after 6 months, they started having mortality. So a lot of people came, everybody, gave whatever treatment was needed, treatment was given, but proper detailed investigation was not done, and they were losing lots of animals. So they came to me in Mumbai, saying that, sir, it's about 70-80 kilometers away, but you need to come here and invest so much of money. So finally, I agreed. I said, okay, I'll come down and do the investigation. I went there. I mean, this is something which is I think extremely useful for all those who are attending to outbreaks and mortalities in private farms, especially. So there I started inquiring about what is the pattern of mortality. How many cases. That is what we do. We construct in epidemiology what is called as an outbreak curve. And in the outbreak curve, what you also do is the progress of new cases. So how new cases have started, from when it has started and how it is getting built up over the time period versus the mortality. So that will tell you what is the incubation period number one and what is the course of the disease, how many days the disease is there, in the animals. And I found out that it was quite irregular. So the manager said, 1 or 2 cases died. So I asked him, whether you can show me some diseased animal in the farm. They said, no, there is no diseased animal right now. Then I got suspicious. I then, there were 5 owners and they were all living in Mumbai. And, their farm was 80 kilometers away. So I just asked the owner whether you have ever seen a diseased animal. They said, no, usually, the manager will call in the morning and saying that 2 bucks have died. And if you keep them for long period of time, then disease might be transmitted. So they would bury the animal by the time they come. They used to come in the afternoon. So I got suspicious. I started asking working questions to the manager. Took him to the side and told him that you tell me the truth, otherwise I'll ask police. There's something fishy here. And then he told me that there is no mortality. He was selling off the animal, 1 or 2 animals every 2-3 days. And telling to the owners that there is death and mortality, because of the, they were earning money from it. So this human factor at the time of investigation many times is also important. And that should be given due importance. Another area which I would like to cover for next 5 6 minutes is about lactation management. Milk and lactation management. That is also an area which the which vets need to pay attention. So whenever we start data recording, we also insist that milk should be recorded every 10 days. At least. If you can record daily morning, evening, fine. Otherwise, at least for every 10 days, you should record. And if it is impossible, then at least once in a month. So even the International Committee on Animal Record will also tell you that milk should be recorded at least, once in a month. And that is 2 times. So if tonight I have recorded milk, then tomorrow morning I will start. So it becomes 2 days, 2 times of milk is recorded. And then you can reconstruct the lactation curve. So most of the software that are available in the market, would do that lactation curve construction based on the data which you given. So in productivity management, looking at lactation curve is extremely important, and that is what whenever I go to big farms where there is data recording system, I always tell them that they should take out selected some 20 25 animals lactation record should be presented at the time of visit, and I should be presented with the lactation curve. And with that, I will go and take it out of the how the farm is examined. Now here what you are doing is you are not examining animal, you are examining the farm and the farm assessment. And for farm assessment, you look at animals and then find out how they are affecting the farm. So what I think I was talking about the lactation management. So we look at the lactation management, and you all must be knowing that in case of dairy animals, they should come to peak somewhere around 21 days to 40 days. A good cow will come to peak early, and then that peak is maintained for at least 50 to 60 days. And generally, it is said that you should get 40 to 50% of the lactation production in first 100 days. That's why if you go to Google and type 100 days, milk record, they also call it 100 days contract with cow. They pay a lot of attention to first 100 days. And the idea is you should get 50% of your lactation in first 100 days. Because in next 100 days, there is not much of hormonal influence. There is more influence on your feeding and other practices. So there are some advantages of looking at lactation management. Sorry, I have some problem related to the throat, sore throat. So the first thing I look at is what is the average milk record in first month, and for that we take 3 highest milk record in first month and multiply that with 1.5 in our area. And in India, what we do is we multiply it by 1.5. And if I multiply it 1.5, it should give me the peak. Say for example, if in first month the best 3 case records average is at 10 liters, then in that case the peak yield at 21 days to 24 days should be around 15 liters. And then I look at whether it has come to that peak yield, as per the formula, multiplied 1.5. If it has not come to that, then there is a problem of energy balance. Okay. Then I look at if we kill and then for how many days the pea is being maintained. Now, normally, as I said earlier, the pea kill should be maintained at least for another 40 to 50 days. And that will depend on how you are maintaining the energy balance of the animal. So if that is being maintained, then you know that the nutrition is high. Another factor to consider at the during with the lactation curve is when the first estrus has happened. What is the time of first estrus expression? And that is also extremely important because let's say, in our area, whenever I used to ask the, vets as to, when the first thing should occur after calving, most of them would say around, 60 days, 70 days, 80 days. No, the first thing should happen within 30 days, 21 to 30 days. And if animal is coming to heat in first 30 days, it tells you that the energy balance of the nutrition is good. That means it is not only supporting supporting the milk production, but it is also supporting the recycling, the estrus cycle. Because after calving, the estrus cycle gets second priority and milk production gets first priority. So many times you find animals are giving good milk, but they are not coming into heat, and lot of their energy is being diverted towards milk production. But if your feeding is good, if the energy in feed is good, then both these will come. Both these will result into first heat, which is early up to 30 days, and then you find that the animal is also giving good milk, the lactation curve is maintained. And then I also look at when is the conception taken place, and with conception whether the animal's milk is also going down by 1.6%. So having lactation curve in front of you when you are taking a round of the farm is important. The second important determinant of health of the animal and the productivity, which in our area is mostly neglected, and that is housing of the animal. We pay least attention, and therefore you'll find, at least India I have found, that housing means wherever there is space available, tie the animal. That becomes its housing. And whatever is available, feed the animal. That becomes the nutrition of the animal. And if the farmers are following this, there is no way that they will be able to reap any benefit from the high yielding animals which they are creating by cross breeding program. So I went to Brazil. And Brazil, we were taking out in that Uberaba area where they have lot of these democratic geese, Sahiwal, not Sahiwal, geese, Tharparkar, as well as some buffaloes. There's also Brahman, breed of cow. We have seen hundreds of them. And while taking them out, I found something very striking that their farm was not having any wall, no wall. They may be having a compound wall of the area, but inside where the animals are being reared, there is no wall. So I asked them, how come you don't have any wall? So why you are keeping like this? So they have a very simple compound, which is made of wood, plank, or bamboo, or some might have iron, just a simple compound. Another striking thing I found was that they were not having cement concrete flooring. They were having all very good earth floor. And some area, which they had kept, as a shaded area for animals to animals to take rest in case it wants. And that struck me. And then they said that this they are doing because the basic principle of animal housing for maintaining good comfort as well as health and productivity is that the farm should be dry. Then I asked them, are you washing your animal? They said, no, we don't wash ever our animal. And we find that in India, most of the farmers will be washing their animals morning and evening, washing their floor morning and evening. So a lot of water is wasted. Whereas if you look at the dairy farming, mostly this is very common in dry area, low rainfall area where water is in shortage. So what you are doing is you are wasting lot of water unnecessarily, causing more harm. I had gone in Lucknow to a military farm and they had problem of severe mastitis. Prevalence of mastitis is very high. So they requested me to come down and look at what wrong they were doing. So I went there and I saw 25 jawans, soldiers. They were all with water. They were washing the animals. They were washing the floor, and they were having all brushes, pick and span. And the area should be clean. The concept we have is the farm should be very clean. See, farm can never be clean because animal will be defecating 24 hours, urinating 24 hours. But somehow they were using this, and therefore the climate was absolutely wet. The floor was absolutely wet. And then I asked the manager, why you are doing all this? Because we need to keep it clean. I said, look, this is your problem. So whenever I visit a farm, I look at the floor and look at the area, and we can tell you what disease he has. Because housing and environment is a very critically important determinant of disease and health. I can tell him whether you have got respiratory diseases. I can tell him, how much cases of mastitis. Because somehow these international companies who came, they also brought their housing system, from the temperate region, cold region, where everything. We have got sun, and we should take help of the sun. So with that idea, first what I did, I wanted to really test, whether that is really, an important issue as far as this is concerned. So I did a small experiment. I dismantled, at a college farm, one animal house is there converted into a very simple, bamboo which we had in the farm. We considered as a small house, farm for them, and we left the animal food. And then we found that, a lot of improvement in animals' health as well as in animal productivity. Simply by untying them and removing their stress, we could get about 10% increase, in the production, milk production. The second important thing which we found was these animals were able to express their sexual behavior. So we could first time see animals mounting. So that, in the textbook, we say, mounting heat or submission heat. That we were able to actually see in the farm. Those things you do not see when you tie the animal because they are tied, so you can't do anything. Number two, when you are tying the animals, they will be passing dung and urine on the floor and they will sit because you have got a small leash. Here also I have found that virtually the animals are under shackle, like in the prison you have sometimes even leg is also tied, neck is also tied, and you have got a leash which is on this side. Now that becomes a problem and determinant. I will call it a risk factor or a contributing factor of all the problems in the farm. So always, when I go to the farm, I look at what is the housing system, management system, and whether that needs to be improved because with that improvement, with simple intervention, you can solve a lot of problems. So I went to that military farm. I told them your problem is this. You stop this. So now with this idea, what I did, I convinced one big dairy in Maharashtra that I would like to have at least 50 such farms in the area where we will convince the farmers that they will go for untying the animals. They will have very simple housing system. And this is an experiment I did for 5 years to prove that animal housing is an important determinant of disease control, health, as well as productivity management. So we worked with them and then developed a very simple, different models for starting from 5 animals to 100 animals. And the cost of construction was starting from zero because the farm labor was used, whatever was available in the farm was used, the material whatever was available was used, to around 50,000 for a farm which is having 50 animals. And now the situation is, if you go to those farms, the farmer will tell you, we do not have any case of mastitis. Because mastitis there was happening because the animal which its udder was sitting on tongue and urine all the time. And therefore, there is chance of bacteria getting into it. Then I'm telling you all these simple things because controlling diseases is important if you consider other factors other than bacteria. So we have to get our mind slightly away from the infectious agent because infectious agents are very smart. It's very difficult to get rid of them. If you cannot get rid of them, at least get rid of other factors which will help them in establishment. And that is important. You cannot have done which will be, derived from E. coli, derived from Campylobacter, derived from Klebsiella, Salmonella. It will always be there. But you can always, you can always have a condition where you are not allowing this Campylobacter or other bacteria to get an entry into each canal. If you are able to do that, then you are going to solve the problem mathematically. So in those farms, now those are around 5,000 farms in one cluster only. They say that they have not called doctor, for treating mastitis. They have not called doctor for respiratory, solving the respiratory infection problems. Most of the time, it is only the inseminator who will come. This particular farm where I have been consultant since last 25 years, I've got around 500 animals, and their medicine bill will never exceed 60,000 rupees per year. Because everything is preventive, all setup is preventive, right from housing to everything is protected. Another important factor which you will keep in mind is disease in disease. Prevention of the disease is immunological status of the animal. No matter what, no matter how much infectious material is floating around, whatever may be the virus load, you will find that there will always be only 5 to 10% or at the most during pandemic and outbreak 20% people who will be affected. Other 80% are not affected. Our problem as a scientist is we look at those who are getting affected disease. We don't look at factors because of which 80% are not getting affected or 90% are not getting affected. So probably we learn more from investigating why the disease was not there in a particular set of animals, and also you can also look at what is the factor which is responsible for those. So immunological status is extremely important, and for that what is needed is that you need to consider two factors when you are doing vaccinations in order to prevent disease in a population. Now I'm talking about a general population. I'm talking about. We do vaccination, for two purposes. One is, we want to protect a particular animal, and number two, we want to see that we don't have an outbreak in the population of animals. So these are two distinct areas of, practicing vaccination. When I do vaccination of individual animal is protected. But in order to see that the disease doesn't come in the population, you need to at least vaccinate 90% of the animals. Then the infection will not come inside. Number two, the immunological status of all the animals should be more or less similar. Look at polio. We could eradicate polio in many countries only because the vaccination of all the susceptible children was being done at the same time, on the same day. So therefore the entire population is at the same level of immunity. So same thing also holds good for animals. So whenever you are doing vaccination in a farm, I always advise that all animals in the animal house should be vaccinated at the same time. Any animal that is coming inside should also be vaccinated before getting inside the herd. If these two things you follow, then many diseases will not be an issue. And another factor is you need to consider in case of daily practice is protection of calves. Because calves have got very high mortality, and I'm sure even in Bangladesh, you might be having this problem of high calf mortality, and this high calf mortality is basically because of lack of passive immunity which the calves receive from their mothers to colostrum. Now, in case of dairy animals, you know that no antibodies will pass through present to the calf. So all the passive immunity which a calf will get is only through colostrum. And therefore colostrum, in case of, whenever you are into a farm where you are advising about high calf mortality, addressing high calf mortality, paying attention that all the calves after birth should receive colostrum as soon as possible, and that should be the first feed. That is extremely important. And secondly, if you find that there is a high calf mortality, let's say for example, lots of young calves are dying, let's say with hemorrhagic septicemia, or foot and mouth disease, or any other disease. Now, in that case, if it is mortality is very high during first 3 months, there the determinant of the problem is the lack of antibodies in colostrum. And the reason behind that is somehow we develop a mindset that pregnant animals should not be vaccinated, which is not correct. Pregnant animals should be vaccinated because on the contrary, I always practice pregnant animal vaccination in last trimester, and sometimes I do even booster. In one farm, we were having high calf mortality because of foot and mouth disease in young animals. So what we did, we took colostrum samples and sent to a lab to find out, what is the antibody level of, specific FMD antibodies in colostrum, and we found it was very low. And then we started vaccinating pregnant animals, with FMD vaccination twice, with 1 month difference. And then we found that colostrum was very high in FMD antibodies, and calves were protected up to 3 months. And then if we give vaccine after 3 months, calves will get active immunity. So these are very simple, interventions in a farm management, which will result in, not only health management, reduction of, disease conditions, as well as the productivity and fertility management. So this, herd medicine which I'm talking about is a collection of all the interventions in a farm, and the whole idea there is to see that the animals get profit. That is very important. Therefore, if you go to United States, Europe and Canada, you'll find the vets over there work with the farm as a business person. Their job and their mandate they get from the farmer is to ensure profit. And therefore, they always look at the points where the farmer is losing money, where the farmer is losing his profit. And those are the areas which need to be plugged. So we need to develop similar kind of approach. Otherwise, our farmers, will not be able to flourish, will not be able to make money. And that we have shown in the area which I was talking about in Maharashtra, where currently there are around 50,000 animals, with around 25 to 30 animals in each house. And we found that in 10 years, they have come to a stage. We have come to a stage where all those farmers who are having bicycle, having a small herd, now have a good house, now have a car in front of their house. They have two-wheelers in front of their house. And when you talk to them, if ever there is a team which is coming to India, I will strongly recommend that they should also pay a visit to that area and talk to the farmer how this herd medicine approach has transformed their activity from just a subsistence, and they are earning about, with 20 cows, good cows, they are earning about 100,000 rupees per month as their profit. So this is what the herd medicine can bring about the change. And inshallah tomorrow when we will go to the farm, there I will be able to give you practical hint of taking the farm round and how at the point we need to assess the farm performance and advise the farmer different kinds of interventions. So with this I take your leave, and if there are quick, can I take 1 or 2 questions if it is there, or we can have questions later on tomorrow? Okay, thank you very much.
Thank you.